Good morning, my dear students. Today I will try to focus on the spinal cord lesion structure and functions and some of the injury of the spinal cords and its findings. So all of you know I have finished some part of structure and function of the spinal cord. So today I will try to focus the lesions of the spinal cord in a brief way. So the degree of intensity and site of the injury will reflect the sign, symptoms and clinical feature of the spinal cord injury or spinal cord lesions. So let's focus on the complete transaction of the spinal cord. In case of complete transaction of the spinal cord, there are three important stages after their spinal cord is transected or undergoes its own lesion because of any injury or because of any causes. So what are those three stages? Number one is stage of flaccidity. Number two is stage of reflex activity. Number three is stage of reflex failure. So what is the stage of flaccidity? In stage of flaccidity, it is the immediate stage after there is complete transaction of the spinal cord. In case of complete transaction of the spinal cord, the first important stage then human beings has to pass is the stage of flaccidity, and it is also called stage of spinal shock. It is called so because immediately as soon as there is injury or total hemisection of the spinal complete section of the spinal cord, the spinal cord loses control from the brain, and that's why various sign, symptoms and features can be seen. These are: number one, all muscles will be paralyzed. There is a complete loss of muscle tone, loss of all sensations and reflexes. Bladder and rectum are paralyzed, and there is severe fall of blood pressure up to 40 mm of mercury column due to loss of connection with the vasomotor center. And that's why, because of the severe fall of blood pressure, with a patient may go into a stage of shock, and that's why we call it a stage of spinal shock. In this stage, because of severe fall of blood pressure, blood flow to the different parts of the body will decrease. In the skin, there is a decrease in the blood flow along with the loss of sensation, and because of immobility of a certain body parts, there is ulceration or bed sore on the point of contact with the bed, and these are called bed sores, and this is because of decreased blood flow to the site of contact point dependent parts, immobility and loss of sensations. Actually, the stage of spinal shock will persist for some period that depends on the phylogeny or the different species of the particular organism. In case of frogs, it persists for few minutes. In case of cats and dogs, it persists for few hours, and in case of monkeys, it persists for few days, and in case of human beings, it persists for 3 to 4 weeks. So that is, the higher the phylogeny of the particular animal, prolonged will be the stage of spinal shock. This is because the degree of encephalation is different in different type of animal. What is encephalation? Encephalation means is a control of the neocortex over the spinal cord. So more is the encephalation, so more is the control of the neocortex over the spinal cord. So spinal cord is dependent on the neocortex for all type of motor commands or informations or any type of activity. The spinal cord has to depend on neocortex. So in higher animals like human beings, the neocortex is very much developed, and it is a site of intelligence, is a site of creativity, is a site of social behavior, rational thinking, critical behavior, anything, any higher functions is because of neocortex, and this neocortex control the spinal cord. So in case of total hemisection or total section of the spinal cord, when spinal cord lose control over lose contact with the brain, then spinal cord don't become independent, and it don't know what to do in absence of the command from the neocortex. And that's why the stage of spinal cord spinal shock or stage of flaccidity will persist for a long time in case of higher animals like human beings. And you should know something about release phenomena. What is release phenomena? When the lower level of the spinal cord acts of its own, it acts in a different manner. The activities which were absent when it was under the control of the neocortex now starts appearing as if the lower levels have become free from the control of the higher levels. So this is called release phenomena. So that is very important, and this exerted activity in case of release phenomena can be explained by the basis of denervation hypersensitivity of the spinal neurons. So this is called release phenomena, means when spinal cord loses control of from the brain, it works of its own. So the activity which was under inhibition because of this contact with the neocortex now become appearing, and all the exaggerated reflex we call it release phenomena, and it is because of denervation hypersensitivity. Next important stage is stage of reflex activity. First stage is stage of flaccidity or stage of spinal shock. We call it a spinal shock because blood pressure tends to decrease because of total cross section of the spinal cord, as spinal cord lose control from the neocortex or the brain. The next stage is stage of reflex activity. In this stage, activities of the affected tissue gradually reappear. That's why we call it stage of reflex activity. Smooth muscle regains its tone, and first important smooth muscle that regain its tone is internal urethral sphincter. So there is an increase in the tone of the internal urethral sphincter, so there is a retention of urine. That is the most important. In stage of flaccidity, there is a bladder and rectum evacuation. Patient cannot control its own urine flow. So but in stage of reflex activity, smooth muscle of the internal urethral sphincter will regain its tone, and that's why urine retention will be there. The next important smooth muscle that will gain its tone is vascular smooth muscle, and because of that BP tends to become normal, but still there is a fluctuation of blood pressure because spinal cord is totally dissected from the vasomotor center, and baroreceptor reflex cannot play an important role here, so there is a wide fluctuation of the blood pressure. Various segmental vascular reflex also reappear. Tone of the skeletal muscle also returns gradually, and most important thing is the flexor tone returns first, followed by extensor's tone. That's why after complete section of the isolated spinal cord, we call the flexor tone will predominate, and that's why you call it paraplegia in flexion. So paraplegia in flexion will be seen in case of stage of reflex activity. Tendon jerks also reappear. Initially these are feeble, but later on it become exaggerated, and which is because of release phenomena. At this stage of reflex activity, in the later part, withdrawal reflex, mass reflex can be seen. What is withdrawal reflex? Withdrawal reflex means if you touch very painful object, so suddenly there is withdrawal of the limbs or particular part of the body, so that is called withdrawal reflex, and this will reappear. This reflex was lost in case of first stage of flaccidity, but will reappear in the stage of reflex activity. Next one is mass reflex. What is mass reflex? Mass reflex will also appear in case of stage of reflex activity in the later part. And what is this mass reflex? After strong noxious stimulus, there is a irradiation of the impulse within the spinal cord, as the inhibition from the higher self or higher levels of the brain is absent. There is a then flexor spasm, contraction of the abdominal muscle, evacuation of the bladder and rectum, and sweating. All these occurs reflexly in a case of complete transaction of the spinal cord, and this is called mass reflex. So here we finish the stage of reflex activity. So in reflex activity, what is the first important thing you are going to see? Return of the tone of the internal urethral sphincter followed by retention of the urine. So there is no more evacuation of bladder and rectum. At the same time, there is an increase of the tone of the vascular smooth muscle. That's why BPU tends to become normal, but still there is a wide fluctuation of the blood pressure. This is because baroreceptor reflex does not play an important role, because higher centers are dissected from the spinal cord. And most important thing is that all the reflexes tends to become normal. Flexor tone also becomes normal, and there is a situation called paraplegia in flexion. And mass reflex, withdrawal reflex can be again seen in case of stage of reflex activity. Next important stage after the stage of reflex activity is called stage of reflex failure. Here, if the patient remains uncared, he will suffer from severe infection and may suffer from toxemia. And ultimately, threshold for all the reflexes will gradually increase, and ultimately there is a stage of reflex failure and finally death. So these are the various stages a person will individual or person or patient will pass when there is a complete transaction of the spinal cord. Okay, next we will go for what are the findings in case of injury at different level of spinal cord. Now first important thing you should remember that if there is a lesion at the above the level of C5, fifth cervical segment of the spinal cord, above the level of fifth cervical segment, there is only one clinical feature, that is respiratory muscle paralysis, and because of that there may be chance of death. Can you understand? And below the cervical lesion, fifth cervical region, if there is a damage of the spinal cord, it depends on the site of the lesion, at the level of lesion or below the level, the site and the extent of the damage, the final clinical feature depends. Okay, so in case of complete cord section or spinal cord section in injury, so what are the sign symptoms or findings? Number one is at the above the level of the lesion. In case of complete section of the spinal cord above the lesion, you will see everything is normal. Everything is normal. Motor function, sensory function, all are normal. At the level of lesion, you will see feature of lower motor neuron lesion, and there is a loss of all sensation, and band of hyperesthesia can also be seen in case of features of the complete cord section at the level of lesion. And below the level of lesion, you will see features of upper motor neuron lesion and loss of all sensation. So in case of complete cord section above the level of lesion, everything is normal. At the level of lesion, lower motor neuron type of lesion or lower motor neuron type of paralysis, there is all loss of all sensation and band of hyperesthesia can be seen. And in case of below the lesion, there is upper motor neuron type of lesion and loss of all sensations will be there. Next we will go for features or injury of the spinal cord in case of incomplete cord section. So what is incomplete? Incomplete, we thinking that in case of incomplete there is a hemisection or half of the spinal cord is damaged. In such situation, at the level of the lesion, everything is normal. Above the level of lesion, everything is normal, but at the level of lesion, features of lower motor neuron on the same side of lesion and normal motor function on the opposite side. So on the same side of lesion, in case of incomplete cord section or on the side of injury, at the level of lesion, you will see on the side of injury lower motor neuron type of paralysis or lower motor neuron type of lesion, and on the same side all sensations are lost, but pain and temperature fibers are injured. That's why opposite side pain and temperature will be lost, and band of hyperesthesia can be seen on the same side. And what we will see in case of below the level of lesion, below the level of lesion on the same side, there is extensive motor deficit of upper motor neuron type of damage. Can you understand? And there is a loss of fine touch and proprioception due to damage of the tracts of gall and Baidya. Pain, temperature and crude touch sensation persist, which cross to the opposite side in the anterolateral system and escape. On the opposite side of the lesion, on the opposite side of the lesion, where everything is, there is no damage. In that side, there is only slight motor paralysis because of damage of the anterior corticospinal tract, but there is extensive sensory loss due to damage of the anterolateral system. So there is loss of pain, temperature and crude touch. Can you understand? So there is loss of pain and temperature and crude touch in the opposite side of the lesion, because pain temperature fibers cross to the opposite side via near the central canal of the spinal cord. Okay, so these are the various findings in the complete and incomplete section of the spinal cord, or findings because of lesion at the different level. Okay, now we'll go for important applied aspects of the lesion of the spinal cord. So number one is Brown-Séquard syndrome. What is Brown-Séquard syndrome? Brown-Séquard syndrome means a collection of syndrome or collection of sign symptoms of clinical feature because of hemisection of the spinal cord. So what you will see in case of Brown-Séquard syndrome, there is extensive sensory loss but minimum motor loss of the opposite side of the injury. Means in the opposite side of injury or the normal side of injury, there is extensive sensory loss but minimum motor loss in the opposite side of the injury where there is no injury. Where in the site of injury or on the side of injury, the minimum or section of the injury, there is a minimum sensory loss but extensive motor loss. So that these clinical features together we call it Brown-Séquard syndrome, and it is seen in case of hemisection of the spinal cord. Okay, so if you know this much at your level, it is enough for you. Next one is Stapes dorsalis. What is Stapes dorsalis? Stapes dorsalis means it is a complication of neurosyphilis. All of you know syphilis. Syphilis is a infection caused by Treponema pallidum, which is a sexually transmitted disease, and it was a center of attraction during 19th century. All the clinician must know syphilis, because many syphilis, if you know syphilis that time, means you have cured many diseases, because syphilis was a center of attraction for all the clinicians that time. So during that, so one of the important complications of syphilis is neurosyphilis or spinal cord involvement of the syphilis. So it is a part of a manifestation of neurosyphilis, and there is a degeneration of the posterior nerve roots up to the dorsal root ganglion, and there is a degeneration of the dorsal column also. So there is a loss of pain sensations And there is also loss of position sense, vibration sense, and sensory ataxia can be seen. Can you understand? So there is a loss of posterior nerve root up to the dorsal root ganglion. So posterior column of the spinal cord is involved in case of syphilis. So because of involvement of the posterior nerve root and posterior column, so position sense, vibration sense, sensory ataxia, all those things are involved. Can you understand? So this is stapes dorsalis, which is nothing but complication of neurosyphilis, and syphilis is caused by Treponema pallidum, which is a sexually transmitted disease, and it may also lead to some cardiovascular complication like vasculitis, aortitis, and all those things. But for spinal cord lesion, it leads to stapes dorsalis, where the vibration sense, position sense, sensory ataxia are lost, or sensory ataxia can be seen, and there is a loss of position sense and vibration sense, and along with this sensory ataxia can be seen because posterior column of the spinal cord is involved. Next we will go for syringomyelia. What is syringomyelia? Syringomyelia means it can be also seen in neurosyphilis, but or any tumor, intramedullary tumor or extramedullary tumor. And what is syringomyelia? It is nothing but dilatation of the central canal of the spinal cord. So all of you know, if you take a cross section of the spinal cord, it is butterfly in shape or oval in shape, and the central contain the gray matter, and in the center of the gray matter contain one central canal. We call it spinal canal also, which is filled with CSF and help in the flow of CSF. Can you understand? So this syringomyelia means dilatation of the central canal of the spinal cord because of any syphilis infection, or because of any intramedullary tumors or extramedullary tumors compressing the central canal of the spinal cord or spinal canal at certain level, and leading to the accumulation of the CSF, and CSF will give a pressure, and ultimately the central canal will dilate at some level, and once it dilated, it give a compression on the pain and temperature fiber which pass very near to the central canal of the spinal cord. Can you understand? Pain and temperature fibers of certain side cross to the opposite side very near to the central canal of the spinal cord, and that's why during the passaging, it may, if there is a dilatation or excessive enlargement of the central canal of the spinal cord, it will give a compression on the pain and temperature fibers, so which will be injured, and that's why the patient may suffer from loss of pain and temperature sensations. But whereas since posterior column is not involved in case of central canal dilatation or syringomyelia, so touch fibers are intact. So there is no loss of touch sensation. Can you understand? So pain and temperature fibers are lost and touch sensation is intact. So what will become? So what is the scenario? The scenario is like this. Ultimately, if the patient touch very hot object, what will happen? You will feel that, okay, he is touching some hot object, the sensation of touch is persist, but pain and temperature fiber is lost, means he cannot differentiate and he will not feel any pain and cannot diagnose the temperature of the particular object. So there is no withdrawal reflex, and that's why the patient may suffer from injury because of high temperature. So such type of injury is called painless burning, and also known as dissociated anesthesia. It is also known as dissociated anesthesia. Okay, so it is also known as dissociated anesthesia or painless burning. Why painless burning? If you touch a very hot object, touch sensation is there, so intact. Touch sensation is intact, so the subject will feel that, okay, he is touching a very hot object. But the role of the pain sensation, pain and temperature fibers is damaged because of central canal dilatation, which because of enlargement it compresses the pain and temperature fibers, so they are involved, they are injured, and that's why the pain and temperature fibers are injured, and because of that there is a loss of sensation of the pain and temperature. That's why the subject will not feel the pain and temperature when he touch a very hot object or burning object. So ultimately the finger or the area of the contact will burn without any pain. So we call it painless burning, or also known as dissociated anesthesia. Okay. So another condition you don't forget is subacute combined degeneration of spinal cord. Subacute combined degeneration of spinal cord, which occurs because of vitamin B12 deficiency. And also seen in case of vitamin E deficiency, also seen in case of copper deficiency, but most commonly vitamin B12 deficiency. So what is happening in vitamin B12 deficiency? All of you know vitamin B12 is an important vitamin, which is also known as neurovitamin or neuromodulator. It is also active form is methylcobalamin, cyanocobalamin or adenosylcobalamin. So methylcobalamin is most predominant, and it helps in myelination of the nerve fibers, myelin sheath formation. And once there is a deficiency of vitamin B12, there is a degeneration of the posterior column and lateral column of the spinal cord, and that's why both motor and sensory fibers will be deficiency may be seen. So this is called subacute combined degeneration of the spinal cord. Subacute combined degeneration of spinal cord, which occurs because of vitamin B12 deficiency, may occur because of vitamin E and copper deficiency also, but vitamin B12 is most commonly seen, and it can be associated with pernicious anemia or megaloblastic anemia, because vitamin B12 also leads to certain type of anemia. Okay, so and posterior column and lateral column of the spinal cord is involved. Next we will go for anterior rhizotomy. This is an important term you should not forget, or should always remember. What is anterior rhizotomy? It means cutting of the anterior root of spinal cord. So all of you know anterior root carry motor fiber or sensory fibers. It carry motor fibers. So there will be degenerative changes in the neurons involved along with the lower motor neuron type of paralysis, and there will also be loss of sympathetic supply in case of thoracolumbar segments and loss of parasympathetic supply in sacral segments. So that is called anterior rhizotomy. So here anterior root of the spinal nerve is involved. Anterior root contain motor fibers, so motor nerves will be involved. So lower motor neuron type of paralysis can be seen. Another term you should not forget is posterior rhizotomy. Posterior rhizotomy means dissection of the posterior root of nerves, spinal nerve, posterior root of the spinal nerves. It will also be lead to degeneration of the changes in the neurons involved, and there will be loss of all sensations and production. Now all of you know that posterior root always contain sensory fibers. So sensory fibers are entering into the spinal cord through posterior nerve root, and motor nerve root is coming out through anterior. Motor fibers are coming out through anterior root. So this is together known as Bell-Magendie law. So posterior root contain motor and sensory fibers. So when there is a damage of the or dissection of the posterior root, you will see sensory fibers are involved. So loss of sensations actually, and there may be production of trophic ulcers, vasodilator response, loss of vasodilator response, muscle tone in certain region may be affected, section of one root may go unnoticed if there is extensive overlapping. Okay, so this is the posterior rhizotomy. So in posterior rhizotomy means damage or dissection of the posterior nerve root, and anterior rhizotomy means damage of the anterior nerve root. Next important syndrome you should not forget is anterior cord syndrome. What is anterior cord syndrome? In anterior cord syndrome, here when there is a damage of the anterior part of the spinal cord or anterior hemisection of the spinal cord, here it may occur because of infarction of the anterior spinal artery, which supplies the spinal cord. So if anterior fibers are involved, pain and temperature fiber may be involved, so loss of pain and temperature may be seen. This is called anterior cord syndrome. What is posterior cord syndrome? There is another term known as posterior cord syndrome. In posterior cord syndrome, here posterior segment of the spinal cord is involved because of any hemisection from back, and it is also because of infarction of the posterior spinal artery. Here pain, posterior column will be involved. So position sense, vibration sense, proprioception all will be lost. Okay, in case of posterior cord syndrome. There is another syndrome known as central cord syndrome, where central part of the spinal cord is involved. Next, another important term we should not forget is conus medullary syndrome. What is conus medullary syndrome? Conus medullary is a terminal part of the spinal cord. All of you know it is at the level of L1 to L2, is a pointed structure at the level of the terminal part of the spinal cord at the level of L1 and L2. So if there is a damage to that area, then we call it conus medullary syndrome. This area supply the bladder and the rectum. So bladder and rectal evacuation can be seen in such syndrome. So it is called conus medullary syndrome, or syndrome or injury to the conus medullaris, which is nothing but terminal part of the spinal cord which is at the level of L1 and L2. Next one is cauda equina syndrome. What is cauda equina? Cauda equina is nothing but a group of fibers. This group of fibers like a tail of a horse that extends from the conus medullaris until it reaches coccyx or sacrum part. Can you sacrococcygeal area? Can you understand? So in injury to this cauda equina may leads to cauda equina syndrome. Okay, so there may be loss of various sensations or fibers supplying the various parts of the body by the cauda equina. So this is called cauda equina syndrome. Now you should not forget that sometimes spinal cord, a special type of surgery is also done where spinal cord is dissected. Can you understand? So that type of surgery is known as anterolateral cordotomy. Anterolateral cordotomy, you should not forget, anterolateral cordotomy is a special type of surgery where the anterothalamic spinothalamic tract is dissected. So all of you know anterior spinothalamic tract carry the pain and temperature fibers. So pain fibers are damaged. So pain sensation cannot be carried to the so there is no feeling of pain sensations. So it is done in case of to relieve patient from intractable pain or severe pain in cancer patients when they cannot tolerate or you cannot control the pain in case of cancer patient by opium or morphine. Then they shift to this type of surgery, anterolateral cordotomy, so that pain in case of cancer surgery, cancer patients can be tolerated because of the followed by this surgery. And this is operation is known as anterolateral cordotomy, where anterior spinothalamic tract is damaged or dissected using surgery. Okay, so these are various lesions of the spinal cord. Now you should know some of the what are the conditions or scenarios or causes of spinal cord injury and spinal cord lesions. So number one you should not forget is road traffic accident or blunt trauma or fall from certain height. So injury of the spinal cord or lesion of the spinal cord is mediated mainly because of road traffic accident like car accident. Car accident, suppose when there is a hyperextension of the of your spinal cord or hyperflexion of the spinal cord or lateral extension of the spinal cord, all these things leads to injury of the spinal cord because of pressure of the vertebral bone on the spinal cord and lead to spinal cord injury or spinal cord lesion. Other than this, there may be because of tumor. So some intermedullary tumor, spinal tumor, interspinal tumor or extramedullary tumor may compress the spinal cord and may cause injury, or because of any fracture of the vertebra column. So vertebral bone, some sharp bone may fracture of the small part of the vertebral bone may come out and enter into the spinal cord and causes dissection or injury to the spinal cord. So these are another cause of spinal cord lesion or spinal cord injury. Then there may be because of TB, tuberculosis, syphilis. These are some of the causes of infection of the spinal causes or infection that leads to lesion of the spinal cord. Then there may be some because of some surgery, as I told, in some type of neurosurgery like endothalamic cordotomy, we do lesion of the spinal cord artificially so as to give relief from the cancer pain from the cancer patients, pain so that pain can be relieved and cancer patients can be relieved from the intractable pain. Okay, so these are the various causes of spinal cord lesion. Number one is road traffic accident. Number two is fall from certain height. Number three, blunt trauma injury at the back. Then car accidents where there is hyperextension of the spinal cord, hyperflexion of the spinal cord. Then may be tuberculosis, syphilis. Then it may be because of neurosyphilis, or it may be because of some vitamin deficiency. Vitamin B12 deficiency, copper deficiency, vitamin E deficiency leads to syringomyelia, all of you know. Then there may be because of injury or neurosurgery, or because of any tumor, interspinal tumor, intermedullary or extramedullary tumor. All of this may leads to spinal cord lesion or spinal cord injury. Okay, so there we roughly finish the lesion of the spinal cord. And one important thing you should not forget that, again I am telling that when there is a complete transaction of the spinal cord, so there are three important features: stage of flaccidity, stage of reflex activity, and stage of reflex failure. And in what stage of reflex, the stage of first stage, the stage of flaccidity is also known as stage of spinal shock. Why spinal shock? Because the patient may go into a stage of shock because pressure may go down up to certain level because of spinal cord loses control over from the vasomotor center, which is the blood pressure regulatory center, and that's why blood pressure may go down up to 40 mm of mercury column. Okay, so what are the features of stage of flaccidity? In the stage of flaccidity, all the muscles are completely paralyzed. There is a complete loss of muscle tone, loss of all sensation, and loss of all reflexes. Bladder or rectum are paralyzed, so there will be evacuation of the bladder and rectum. So patient cannot control his own urine output, and rectum paralyzed means there will be evacuation of the stool, and there will be severe fall of blood pressure up to 40 mm of mercury column, and because the spinal cord lose control from the vasomotor center, and because of loss of flow of decrease in the blood flow to the various dependent parts of the body because of immobility and loss of sensation, there is chance of bed sore, and the stage of spinal shock will persist. More is the higher the phylogeny of the particular animal, more will be the prolonged will be the stage of spinal shock, because more is the degree of encephalation. So what is encephalation? Encephalation means control of the neocortex over the spinal cord. So neocortex, higher the animal, higher the phylogeny of the animal, there is a more chance that the brain has more control over the spinal cord or new cortex has more control over the spinal cord. So if there is spinal cord dissected, the spinal cord become independent and don't know what to do. So it takes time for the spinal cord to start again its own activity independent of brain, and that's why the stage of spinal shock or stage of flaccidity will persist for longer time when the degree of encephalation in higher males is more. Can you understand? So encephalation you should not forget. And next comes the stage of reflex activity. In a stage of reflex activity, all the bladder tone, interurethral sphincter tone will be regained. That's why there will be retention of urine, evacuation of urine and stool will be decreased, and there will be retention of urine. At the same time, there will be increase in the tone of the vascular smooth muscle. That's why blood pressure will tends to come to the normal level, and there is no there is no fixation of the blood pressure, because there is a wide fluctuation of the blood pressure, because baroreceptors lose its control from the spinal cord. So blood pressure tends to normal, there is a wide fluctuation. Beside you will see paraplegia inflection, segmental reflex, vascular reflex, mass reflex, withdrawal reflex, all will recover. And third important stage is stage of reflex failure. In this stage, what will happen? If the patient left uncared, toxemia, infection can be there, threshold for all the reflex will gradually increase, and there is a stage of reflex failure, and ultimately patient may patient may die, or patient may go into a stage of death. Okay, so these are the various stages followed by complete transition of the spinal cord. Okay, and you should not forget the importance of tabes dorsalis. You should not forget about dissociated anesthesia or syringomyelia, subacute combined degeneration, Brown-Sequard syndrome, anterior rhizotomy, posterior rhizotomy, anterior cord syndrome, posterior cord syndrome, and various causes of spinal cord injury. Okay, thank you very much for today, and let me know how you like my classes, and please increase your study because exam is very near for you. Okay, thank you my student, thank you very much my dear students. Please listen to my classes, it will help you really, I think.